guys are doing.
That's right. Yeah, one of the biggest challenges our region's been facing as we try to fight COVID-19 has been access to testing. We've had a lot of issues with there, mostly availability of test kits, availability of personal protective equipment. But as those things start to come in, we got a delivery of test kits this week from LabCorp. And so for the last few days, we've been planning doing a community pop-up testing site, because while there have been testing opportunities available for people with very severe symptoms or who meet certain criteria, travel history, nursing home, etc., there have not been many testing opportunities for folks who just might have a cough and fever and don't know where to go. They want to get tested. And so we've decided that we really need to stand up community testing sites to meet the demands of that population. So we did that today here. We had slots for about 130 people. We're not quite 2 hours in, but we've had 84 so far, and people are still registering through our call center, 205-3501, 205-3501. They're registering. They're going through a screening process with our nurses and our other staff in the call center, and if they have symptoms or have an exposure they're concerned about, they'll be slotted for an appointment. They'll get a registration and they'll come here. So it's been quite an operation. We've got 4 tents out there. It's a drive-through testing situation. All of our staff are gloved and gowned and wearing personal protective equipment. The law enforcement has been amazing in terms of managing traffic control, making sure that folks who have appropriately been registered come with ID. And so it's been a really smooth operation, which is good news for us, because what it means is that as we have more and more test kits come in and be made available to us, we'll be able to replicate this at different places around the region.
I'm sorry about that. No, you're fine. So tell me how this works, just nuts and bolts. Like,
yeah.
What does the process look like when someone comes in and get tested?
So right now, if you call the call center and you meet the criteria, you get a registration on your phone or via email. You bring that registration here to the checkpoint with law enforcement. They pass you through. Everybody at each point is wearing personal protective equipment in case, because most of all of the people who are coming here today have symptoms, and so we want to make sure that the staff is protected against any kind of exposure. They come through, they drive into one of those, in front of one of those 4 tents. Our nursing staff go in and they either do an oral swab or a nasal swab. Right now I think we're doing oral swabs today. And so they swab you, stick it in the viral media, and then you're on your way. We have your demographic information and we'll follow up with test results when those come back. Right now the turnaround time from LabCorp is about 4 days. We'll see if that happens any quicker.
What's the capacity for how many tests you guys have available? And is it just for Henrico County residents?
No, this is actually an effort of the entire Central Region Incident Management Team. Myself, my 2 colleagues in the Chickahominy Health District and the Chesterfield Health District, Dr. Tom Frank, Dr. Alex Samuel, and then really the unified command of the Central Region Incident Management Team have been hard at work over the last week planning all of the details of this, and the work has paid off. It's gone incredibly smoothly. So we are looking to do this in other parts of our region moving forward. We'll get together today and tomorrow and think about what worked well, what didn't work well, how do we improve the effort and make sure that we can do this for more members of our community.
And do you know how many tests you guys have available? How many people you can test at this point?
Yeah, so we got a shipment of 200 test kits the day before yesterday. So we reserved 130 of those today. We're expecting more, and so we're hoping to do about the same at a testing site at a later date.
And test kits, does that mean that it's 130 people can get, or 200 people can get tested, or that there's, because I remember hearing something about the test kits, multiple people can be tested within them?
Yeah, I think right now each test kit is one person. There are a lot of variations on what media can you use 2 swabs for 2 different people. We're still sorting some of that out in terms of what the testing companies will actually accept.
Gotcha. Sounds good.
And what are the criteria? So you mentioned criteria to be able, it's not anybody can just come and drive up.
Right, yeah. So when they call the call center, our nursing staff will actually ask a little bit about their history, when was their onset of symptoms, what are their potential exposures, and based on those different factors, they'll decide, yes, this person should be tested, or no, they don't need to be. But really, anyone with cough, fever, congestion really should meet that for now.
And so that sounds like the criteria for being registered to come to a pop-up testing site here in the Central Virginia region is a little bit more lax than the CDC?
Absolutely. And that's the point, is that, and it's not the CDC necessarily, because the state of Virginia through the state lab has at this point about 400 tests available to residents of the state. They were, they set up certain criteria to ensure that we didn't run out immediately. And so those criteria, yes, are a little bit more narrow, but as I said, we've recognized that there are a lot of people with just mild symptoms who may have had some exposure. The more we see this disease spread through our community, the more folks we're going to have who fall into that category. This has caused a real challenge for our healthcare community. So many of my clinician colleagues have said, we've got people showing up with fever and cough every day. If we're not prepared, we don't have enough personal protective equipment, then we're losing staff. They've got to go and be self-quarantined for 14 days. And so we're really trying to lighten the load through efforts like this and direct people who have those symptoms to other testing sites so that our frontline healthcare providers can maintain their staffing right now.
And you said that the test results could take up to 4 days from LabCorp. What do you recommend? What are you recommending to people who come here and get tested today? When they leave here, are you recommending that they go home and isolate themselves?
Absolutely. If they're having any kinds of symptoms right now, we're asking them to go home to self-isolate until they've either had a confirmed negative test. In fact, it's actually 2 confirmed negative tests if they've been diagnosed positive. Sorry, let me clarify that. So when somebody comes here with symptoms, they are tested. There's a 4-day turnaround. So we are asking them to go home and self-isolate until we have test results. Now, if they have been diagnosed positive, there are certain criteria we're using before they can actually go back to work. So 72 hours of no fever without the addition of acetaminophen or ibuprofen, complete resolution of other respiratory symptoms, cough, congestion, etc. And then there's a couple more. They just came out yesterday. It's 7 days past the onset of symptoms, and all of those things have to be true. And once all of those things are true, then someone can return to work or school or whatever. I'm not going to school right now, but the CDC recommendation is 2 consecutive negative tests within 24 hours of each other. As tests become more available, that might be the standard that we adopt. But right now, there's such a limited supply of tests that's not really realistic.
And the last question that I have is, so you all are doing this today, you have a capacity for, you said 120, 130 people. You only have like 70 more tests then if everyone takes advantage of that. When are you think you all are going to be able to do another pop-up testing site?
So we're looking potentially Friday or even this weekend to do our next site. We're expecting more test kits to be delivered, but we're also learning that there are other types of test kits that we can be using. So we're looking into the detailed guidance about what non-LabCorp test kits could we use. We have more generic viral test media that we could be using. So we're amassing all of the test kits between among the 3 health departments and any other sources that we can get our hands on to be able to stand up events like this.
So by this weekend would be a good way.
Yeah,
to put
that that's the hope that we can get this our next site up and running either Friday or this weekend.
And how long is this going on for today? Is it just like all day?
It's 12 to 4, and we, again, because we're going through a registration process, we've slotted the appointments, so folks aren't really having to wait that long at all. As you can see now, there's not much of a line. So we'll still be taking calls between now and 3 p.m. If people have symptoms and want to be tested, they can call 205-3501. You'll talk to our call center staff, and if you meet criteria, they'll slot you for an appointment, and then you can make your way over here to the testing site.
Is that the key? You have to have symptoms to call? I mean, is it because you don't want to clog up a line with 1 million people calling that aren't even sick?
There's a lot of worried who are just concerned. Did I have an exposure? I have a friend of a friend who was exposed. Am I at risk? And so we're really trying to avoid folks who aren't showing any symptoms right now. We're really trying to prioritize those who have developed symptoms.
Very good. And I mean, a lot of this sounds like a peace of mind kind of thing too. So you guys can get a handle on how many people have it, but also the people that have symptoms and are worried. I mean, is that kind of part of this too?
I think it does both of those things. I think for individuals, they want to know if they have this or not. That helps us know whether they really need to be self-isolated and whether we need to do a contact investigation. So it helps us from the perspective of limiting community spread that way. But it also helps us know just how much disease is out there in our community, right? Like, we've made some really significant decisions to close schools, to limit gatherings of 10 people, to ask restaurants to not have more than 10 people in their buildings. And at some point, we need the data to tell us what are the disease levels in our community and when can we start lifting some of these restrictions. So from a public health surveillance standpoint, being able to do widespread testing like this really helps us know accurately just how much disease is circulating in the community.
That's great.
Great. Good. So the tests that are being used right now, is that part of that 400 inventory?
300. I think, yeah.
No, it's not. So that the 400 is the number of test kits that the Department of the DCLS, the Department of Consolidated Laboratory Services for the state has. These are test kits that are not being processed through the state lab. They're being processed through LabCorp.
Okay.
And so that's part of the 200 allotment that we got earlier this week. We're expecting another delivery and are, again, going to try to amass a number of test kits from different sources.
Yeah, you've heard a lot of talk about the public versus private. So this
Yeah.
would kind of be a private partnering with public, it sounds like,
Sure,
right?
yeah.
LabCorp and you guys.
Right. The public health departments are standing this up,
Yeah.
but we're using a private testing pathway.
Gotcha.
So
Correct.
if you get a confirmed test out of one of these, do they still have to go to the CDC for confirmation?
Or the state.
Yeah, I think we're at a point where we are no longer moving to confirmation through the CDC. A few days ago, or about a week ago, that was still the case. But we are seeing so much widespread disease in our community that I don't think it's realistic that we'll be able to confirm every one of those through the state lab or through the CDC. I think we are taking those positives at face value and then initiating a contact